Welcome back to Pulse Education. My name's John Carrico. Thanks for joining us once again. Hopefully you've been following along with us as we have been focusing on this notion of taking a disciplined approach when we're looking at a 12 lead, when we're doing that 12 lead interpretation, taking it step by step. And this is actually the last video in a series that we've been specifically looking at axis determination. So in our past videos, we have broken down normal axis. We looked at various aspects of left axis deviation. The last video specifically looked at right axis deviation, and we're going to end the series right now talking about extreme axis deviation. So let's jump right in and take a look at what we're talking about. So we've spent a lot of time making sure that we have this idea of depolarization and the average direction of depolarization, that we have that kind of down pat, right? That when conduction is working normally in the heart, and then the depolarization starting that SA node and working its way down those pathways, that the average direction that depolarization is moving in the heart kind of follows that green arrow, right? From that right atrium down into the apex of that left ventricle, and that is how we defined normal axis deviation. Well, this week with an extreme axis deviation, what's actually happening is the opposite of that. So rather than depolarization starting in the atrium, now we see, for various reasons, that the depolarization is actually starting in the ventricles, right? That there's a pacemaker cell that fires off in the ventricles, and actually what's going to happen is that depolarization is going to move backwards from what it normally should. It's going to be moving from the ventricles, and it's actually going to work its way up toward the atrium, okay? So we get the reverse of normal axis, and thus we call this extreme axis. And we can see here in terms of our numerical values, and we're going to define that typically when that axis is measured at greater than 180 degrees. So let's take a look at some of these ideas. So again, normal axis for normal conduction versus when this depolarization happens in the ventricles. And you can see that somewhere in the ventricles, and that spot can change. Just depends, not one particular spot, depends on where in the ventricles that spark happens. But when it does, you can see this depolarization wave is going to move from the ventricles and moving backwards. And when that happens, the thing we have to take into account is that it doesn't follow conduction pathways when it does that. So conduction pathways are one-way streets, okay? So they move in that direction from the atrium down into the ventricles. If that signal fires off in the ventricles, it doesn't have the ability to move backwards on on those conduction pathways. And so, whenever we're not using conduction pathways, we have to think about that it's going to take longer for that depolarization wave to move throughout the heart, okay? And whenever we think in terms of that longer in the heart, in terms of longer depolarization times, that means that we are going to see a wide complex on our 12 lead, right? Wide complex always means depolarization is taking longer, and that usually translates to less efficiency in the heart, right? That when it takes longer for us to depolarize, that the heart is not going to work as effectively, and it may or may not affect cardiac output, depending on how our patients can compensate. So in terms of our causes, okay, there's a number of causes that can create this extreme axis deviation, and the most common ones by far are going to be ventricular rhythms, all right? And the most common of those ventricular rhythms, the one that we almost default to regularly, is going to be ventricular tachycardias and the various ventricular tachycardias that can occur. Beyond that, we can also have non-tachycardic ventricular rhythms, and those are going to be typically summed up as our ventricular escape rhythms. So ventricular rhythms that are bradycardic in nature rather than tachycardic. And then we can also have COPD, pulmonary embolism, all these pulmonary-like diseases or right-sided heart failure diseases that really are the same as the causes for our right axis deviation. In some cases, that right axis deviation line can be right on the edge of whether it's going to be right axis or move into extreme axis. And that's oftentimes when we have that kind of borderline. So maybe the axis determination is right on that borderline, or 180 or somewhere right around there, that it may be that average direction of our particular patient that we have, their heart, that it's moving that almost into that extreme where it's almost moving backwards or counter to normal, okay? So that can happen. We can also have it happen when we put the leads on wrong. So if we've mixed up our leads and we have lead transposition, that can actually cause us to look like we're having right axis or extreme axis deviation. And the one tell that usually is we'll see a narrow complex instead of a wide complex. So that's a really important thing to do. If you're looking at a 12 lead, you see that you have evidence of what you think is extreme axis deviation, but you have a narrow complex. I'll show you a little trick coming up here on how to look at that. But you need to make sure that you actually have your leads on in the right place. All right. And finally, there's hyperkalemia. Okay, hyperkalemia can cause so many variations on a 12 lead, but certainly one of those things that can cause is extreme axis deviation. And we usually see that when we're talking about severe hyperkalemia for our patients. So the big thing for us to consider of when it's hyperkalemia is going to be when this is grossly wide. So not just a simple wide complex or a wide complex that looks even in terms of ventricular tachycardia, but when it is grossly wide. And I'll show you an example of that coming up. And then the other part with hyperkalemia that we suspect is there's got to be a reason, right? People don't just automatically develop hyperkalemia. So is there a reason for suspicion, and is this grossly wide? All right. So from the aspect of thinking about what our leads 1 and leads 2 and 3, what those deflections are going to look like, right? We talked about it again in normal depolarization. Leads 1, 2, and 3 are all going to be upright. Their QRS complexes are positive in nature because the depolarization wave is moving towards each of those leads, right? Well, as we mentioned here, in extreme axis deviation, the depolarization wave is moving away from these leads. It's moving away from leads 1, 2, and 3, and therefore we're going to see that lead 1, 2, and 3 are all going to have negative deflections, all right? So if that's the case, if we look on our 12 lead, we look and see leads 1 and 2 and 3, and they are all primarily negatively deflected, then that is going to be evidence that we have extreme axis deviation and the depolarization wave is moving backwards. The other part of this that we can kind of use this to kind of double check ourselves is going to be is lead AVR. So lead AVR, in terms of how it looks at the heart, it actually looks at it from almost like kind of up above the right atrium, looking down on the rest of the heart. And really that's opposite of all the other leads on the 12 lead. So in this case, where depolarization is moving away from all the other leads, specifically 1, 2, and 3, it's moving actually towards lead AVR when we're talking about extreme axis deviation. And therefore, we should see a positive and specifically a wide complex, a positive wide complex bleed or deflection in lead AVR. So when we have all these things kind of come together, we can be very certain that we have extreme axis deviation going on right now. In the case now that we had, these were all negative, but they were narrow complex, and AVR was also narrow complex, that would be a very common situation in which we need to be thinking, do we have our leads on wrong right now? It would be very, very strange and almost impossible for us to have negative complexes that all were narrow complex, as well as lead AVR to be a positive complex that was narrow in nature, okay? So again, we've got our extreme axis. One thing that, again, we want to make sure that we're looking at also is going to be our numerical value that the 12 lead has calculated for us, okay? So anything greater than 180 degrees is going to be evident of our extreme axis deviation. You can see down here, again, if we looked on here, that particular number was 218. So obviously that's greater than 180. I like to use both the numerical value along with looking at our leads and the deflection of our leads in 1, 2, and 3. I've referenced this chart also in our previous videos, and we're just adding to that. And so this is a great way to have a quick shortcut. If you don't have this memorized, you can easily find this chart online and again use that as a little bit of a guide, a quick reference guide. But we can see in our extreme axis deviation, if we look out here on the end, that it's going to be greater than 180 degrees, and leads 1, 2, and 3 are all going to be negative deflected. So let's take a look at some examples, right? So immediately we have on here, we have this our 12 lead here. We're going to go through step by step, right? So the first thing is always rate. We can see on here our rate is 160, so obviously that's a very elevated rate that we're concerned about. We're going to look to see if it's regular or irregular. And looking at this, it appears to be that all the QRS complexes march out on the same beat and it's irregular in nature. And so then I determine my axis. So I can either look down here and I see that my QRS axis is 193, obviously greater than 180 degrees, or I can look at leads 1, 2, and 3, and they are all negative deflected. And more so, it's also a wide complex. We can see my QRS duration here is 181 milliseconds, all right? So in this case, I'm dealing with an extreme axis deviation, and in this case, I've actually got a ventricular tachycardia. That is the underlying rhythm, and that makes sense that it's a ventricular in nature. I've got extreme axis deviation. I can now be better at accurately treating our patient. So another example here, okay, so again, I look at my rate, 197 beats per minute, so obviously extremely fast right now. I look to see if it's regular or irregular, and in this case it is regular, all right? I'm gonna look at my axis deviation. In this case it says negative 53. I'm a little leery about that, whether that number holds up. And if I look at my leads 1, 2, and 3, they're actually all negative deflected. There does appear to be a little bit of artifact on here, and maybe that's why the 12 lead is a little bit inaccurate. But looking at this, I certainly think that this is an extreme axis deviation. It's wide and complex. And again, if I look up here at lead AVR, that is a wide complex positively deflected. That to me tells me that the depolarization is moving opposite of what it normally would. And in this case, once again, I believe I've got a ventricular tachycardia here as well. Another example here, again, the first thing I need to do, look at my rate, 118, so that's fast. It's not extremely fast like the other examples we've been looking at, but it is fast. I look to see if this is regular in nature, and as I look across here, it's got a little bit of irregularity to it. It's primarily regular, but just maybe a little bit of irregularity to it. And if I look at my axis right now, I've certainly got down, down, and down in leads 1, 2, and 3, or if I look at my QRS axis, I've got 230. But one thing that stands out to me is that it is extremely wide. If I look at my QRS duration here, it's 210 milliseconds. You can even look on here and just appreciate how wide that is. And so in this case, I do have this extreme axis deviation, but hyperkalemia is going to be the most common suspect of this origin of why this is extreme axis. Next example up here, again, I look at my rate. I've got a rate of 200, all right? It does appear to be regular, all right? I look at my QRS axis, my next step here. My QRS number says 204. I can also look at my leads, and I've definitely got negative deflection in 1, 2, and 3. It certainly is a wide complex in nature as well. And again, another example of a ventricular tachycardia here. In this case, I've got a ventricular rate of 102, so not very fast at all. Typically, as soon as I see the rate of 102, I'm not going to be thinking of this as a ventricular tachycardia. It's borderline that it's even tachycardic in nature, all right? It does appear that it is regular. So then if I look at my axis, I've got a PR axis of 188, or if I look at my deflections, I do indeed have a negative deflection that leads 1, 2, and 3. It is a wide complex in this case, all right? But I do not suspect, based on the rate right now, that I don't suspect that this is a ventricular tachycardia, all right? That we do have some kind of ventricular rhythm right near, but I'm thinking that maybe this is more suspect of a right axis deviation, which is right on that border, and it's going to be maybe potentially something like right heart failure or a pulmonary issue that's causing this, rather than this being a ventricular tachycardia in origin. And finally, for my last example here, again, I look at my rate. I got a rate of 94. I look to see if it marches out, and it does appear regular, okay? I look at my PRQ axis, and actually it's not really showing me anything here. So I need to look at my leads 1, 2, and 3, and I can see that lead 1, it is primarily negative. Lead 2 and lead 3 are definitely negative. But what I notice right away here is that this is a narrow complex. Now, if I look at lead AVR, it's also upright, but also a narrow complex. So because of that, I'm going to be highly suspicious that when I put my leads on prior to doing the 12 lead, that I probably got my leads mixed up. So the first thing I want to do is immediately check that, or go ahead and put the leads back on properly and go ahead and acquire another 12 lead to make sure that I'm doing that correctly. Okay, so that's extreme axis deviation. It gives us a lot of information. Certainly, it's going to help us in terms of rule in, is this patient potentially in a ventricular tachycardia, or are they not? Or is this just a person who's kind of borderline in terms of what the causes of right-sided heart failure or pulmonary issues that cause right axis deviation that is kind of carried over even into where it's an extreme axis, okay? Hopefully that gives you a little bit more insight. Again, that's the last of our axis deviation topics that we're going to be talking about. And the cool thing is now that we've got that underway, we're just going to be applying that to lots more topics that we look at in the future. So when we look specifically at hyperkalemia later, or if we look specifically at looking at pulmonary embolisms and such, when we reference looking and determining that axis, you're going to have such a better knowledge moving forward and being able to put all that into practice. Thanks so much for joining us. We have some really exciting projects coming up that we can't wait to share with you guys. Please continue, like the video, tell your friends about this, subscribe if you can, leave us comments, and know that we got a lot of fun things in store. See you next week.